Proper wearing of personal protective equipment, or PPE, ensures protection of the healthcare worker from exposure to hospital or laboratory-derived infection of Ebola virus. Always put on essential required PPE when handling either a suspected, probable, or confirmed case of viral EVD. The dressing and undressing of PPE should be supervised by another trained member of the team. First, gather all the necessary PPE items beforehand. Key components of personal protective equipment include fluid-resistant or impermeable gowns, N95 respirator, full eye protection, either as goggles or full face shield, and gloves. In circumstances in which there may be uncontrolled splashes or environmental contamination with biological fluids such as blood, head covering and shoe covering will be used. Wear a scrub suit. If shoe cover needs to be used, wear them over closed shoes. Put on impermeable gown. Fully cover torso from neck to knees. Arms to end of wrists and wrap around the back. Fasten in back of neck and waist. Cup the respirator in your hand with the nose piece at the fingertip. Position the respirator under your chin with the nose piece up. Pull the top strap over your head, resting it high at the top of the metal nose piece. Pull the bottom strap over your head and position it around the neck below the ears. Place fingertips of both hands at the top of the metal nose piece. Mold the nose piece to the shape of your nose by pushing it inward while moving your fingertips down both sides of the nose piece. Perform a fit check. Place both hands completely over the respirator. For positive pressure seal check, the respirator will slightly bulge if you exhale greatly. For negative pressure seal check, the respirator will slightly collapse if you inhale greatly. Position goggles over eyes and secure to the head using the earpieces or headband. Adjust to fit comfortably. Put on at this time the head cover if you have concern for splashing fluids. Insert hand into gloves. Extend gloves over isolation gown cuffs. Use double gloves if doing any strenuous activity, such as carrying a patient, handling a dead body, or tasks in which contact the blood and body fluids are anticipated. If an impermeable gown is not available and you expect to undertake any strenuous activity, such as carrying a patient, or tasks in which contact with blood and body fluids, place waterproof apron over gown. While wearing PPE, avoid touching or adjusting PPE. Remove gloves if they become torn or damaged. Change gloves between patients. Perform hand hygiene before putting on new gloves. Remove the most heavily contaminated items first. Be careful to avoid any contact between the soiled items and any area of the face or non-intact skin when taking off PPE. If wearing the apron, peel it off and dispose of safely. If wearing overshoes, remove them with your gloves still on. Touch the highest part of the shoe covered behind ankle. Remove gown and gloves and fasten ties. Peel gown away from neck and shoulder. Turn gown inside out. Fold or roll into bundle. Perform hand hygiene. If wearing a head cover, remove it from behind the head. Remove face shields or goggles from behind the head. Lift it away from your face. Place eye protection in a separate container for reprocessing. Remove the respirator from behind the head. When removing the respirator, lift the bottom strap first and the top strap next. Perform hand hygiene.